Kelsey Lehar, pronoun are she, her, and I'm one of the registered nurses.
I'm Amanda Webb, pronoun she, her, and I'm also one of the registered nurses.
I'm Alexa Anderson, pronoun she, her, also one of the registered nurses here.
And the three of us make up your spirometry team. In this video, we will educate you on what to expect when you come on campus to perform your spirometry testing.
Spirometry is a type of pulmonary function test. It determines how well your lungs work by measuring how much air goes into and out of your lungs when you breathe. The test needs at least 3 successful tries for both the pre and post. Most people take 4 to 5 tries each.
As we prepare for your spirometry test today, a couple of reminders. First up, what we're testing today is the volume and force in which you can expel air from your lungs. What specifically we're looking for is the amount of volume of air within the first 1 second of the test. Most individuals, 80% of their entire lung volume is expelled in that first 1 second. So in order to perform our test today, we have some equipment. First up will be the flow head, in which we will also attach a mouth filter to. We'll place this end to the flow head, and then you'll place this end in your mouth with your teeth and your lips forming a tight seal. Also, to ensure that all of the air is coming through your mouth, we will ask you to use nose clips, again, preventing that air to come from your nose. And then beyond equipment, I will be coaching you verbally how to complete the test, but there's 2 prompts associated with the system. Number 1, we refer to him as Mr. Bluehead. He pops up on the screen when it's time to take an inhale and exhale. And then lastly, there's an incentive in the bottom right-hand corner of the screen, which is the big bad wolf and the little pig. So when you see the big bad wolf puff up, that's when you take a nice big inhale. You'll exhale with the wolf, try to blow the pig's house down, and once you succeed, the pig will sing and dance for you. So as we move forward, we'll use the software system to help guide the test, but it's super important that you stay listening to your nurse during the test for verbal cues on how to properly execute. But if we go to the top left-hand corner of the screen, what you'll see is it takes a minimum of 3 tests to switch to a good session. We have 1 test listed here. Top 2 numbers are what we're looking for specifically. That first number is the total volume that you're expelling as you're conducting the test. And then that second number represents that total volume in the first 1 second. So the big forceful initial blow. As we move to the bottom left, what we're looking for is that initial forceful exhale. That'll create that spike. And as you continue to blow out, you create that ski slope. And as you take the inhalation, it finishes out the circle. And in our bottom right, you'll take that initial exhale. You'll come all the way across till you reach the plateau. So you're blowing out anywhere between about 7 and 9 seconds. And then you're finishing with that inhalation. I'm going to walk you through the tests from start to finish, step by step. So before we start using the equipment, just a couple of reminders that you'll use your ears to listen to my verbal cues that will guide you on when it's appropriate to inhale, move the filter to your mouth, as well as continue to exhale until you make that final inhalation. There will also be visuals on the screen that I'll coach you through, but again, make sure that you're listening to my cues. So first up, how are we feeling?
Feeling good.
Okay.
I'm ready.
So first thing, let's go ahead and put the nose clip on your nose. If you have a piercing, just kind of move it around, again, to make it most comfortable. The idea is to limit the amount of air that's coming through your nose. I know it feels awkward, but that's usually the hardest part of the test. All right, so before we actually do it then, what I will tell you to do is Mr. Bluehead will come up on the screen and I'm gonna ask you to prepare. You'll take an inhale and bring that towards your mouth, and then I'll ask you to place that filter in your mouth and exhale and blow. I want you to think about squeezing your ribs and forcing all of that air out. You need to continue to do that until I tell you to inhale, and then you can remove the mouthpiece.
Got it.
Okay?
Okay.
So, how are we feeling about this?
Ready to
Nothing to be nervous about. Remember, you are gonna have to do this at a minimum of 3 times. So if the first one feels a little awkward, we'll do it again. All right? So I'm gonna hit new test. You're just relaxing right now. And then Mr. Bluehead's gonna come up. I'm gonna ask you to prepare. Take a nice big inhale, fill up your lungs. Place that in your mouth and forcefully blow. Push, 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 push. Keep pushing out that air. Remember, we're getting to that plateau. Awesome job. And take a nice big inhale for me and remove. Awesome job. You can take the nose piece off now as well.
Now we're going to move into the post part of your test. The pre part, we didn't do any medication, but this part we're going to use albuterol here. This is a bronchodilator, so it's going to open up the lungs a little bit. This is the purpose so we can compare it from the first test to the second to see if there's any differences. So what we're going to use today is our albuterol and a spacer. Just a side note, the albuterol can cause a little bit increase in heart rate and some shakiness. So we do want you to limit caffeine and then not use your albuterol inhaler 4 to 6 hours after your test. So to demonstrate this, we're going to attach this for you. We will have you bring your albuterol, or you can use the clinics as well. First, we want you to get all the air out of your lungs. Then you're going to place the mouthpiece here into your mouth. You're going to inhale and press the button at the same time. And then you're going to hold it for about 10 seconds. You can take this out of your mouth while you hold it, or you can keep it in your mouth, up to you. And then we are going to wait 1 minute in between each medication dose for a total of 4. Do let your nurse know if you are feeling any of the side effects. Once you have completed your pre and post spirometry test, the results will be given to your provider. They will reach out to you within 3 to 5 business days via secure message on your CSU Health portal. Before your appointment, please arrive 15 minutes prior to your scheduled appointment time.
Please bring your prescribed rescue inhaler or albuterol with you. If you don't have a prescribed inhaler, we have one in the clinic you can borrow for the testing purposes.
We ask you do not use your albuterol or rescue inhaler 4 hours prior to the test. If you do need to use it for medical purposes, please call to reschedule at 970-491-7121. Thanks for watching our video. We look forward to seeing you soon. Bye.
Bye.